All right, chapter 24, nutrition. Again, I don't own this material. Under fair use, I am providing lecture content for only my nursing students using this material, and all content within is only for educational purposes for nursing students and does not provide medical advice. Nutrition. So you guys probably took a nutrition class, so just a little refresher on nutrition. Nutrition is the study of food and how it affects the body and influences health. So we talk a lot about nutrition around issues with long-term healing, diabetes, right? So you guys know those. Those are easy to think about. But some of them might not be as obvious. So adequate nutrition is essential to wellness as well. And that's where you get into wound healing and things like that. So adequate nutrition is just as important as what you're eating, but what are we eating? How does it affect our health and our ability to heal and stuff? So sources of nutrition information. How do we find out about nutrition information? Typically, you turn whatever it is you're ready to eat over and you look at the label. Okay, so dietary reference intakes. You should know the estimated average requirement of things, the recommended daily allowance of things. So if I were to say vitamin C, what's the recommended daily allowance of vitamin C? Okay, you should know those. An adequate intake, tolerable upper intake level, what is acceptable, an acceptable macronutrient distribution range. So we need to know those. Something like calcium, how many milligrams a day? Okay. You also look at the USDA guidelines for dietary guidelines, but also My Plate and nutrition fact labels. So if you're thinking, what's My Plate? On choosemyplate.gov, they have a very visual scale of how many vegetables to fruits to grains to proteins and dairy you should be eating. So if you look at this plate, there's a large amount of vegetables and smaller amount of fruits. There's a large amount of protein, but we also need grains as well. Grains provide us some of our non-essential amino acids, vitamins, minerals, things like that, that we might not get. And it says protein, it doesn't say meat, because some people don't eat meat. Okay. And then your dairy, of course, it is important to get dairy in. It is important to get fruits in, but there is a amount that you should be eating as well. So you can't go off the deep end and only eat vegetables because you're not getting any protein. Okay, so let's move on. Nutrients, the building block of cells and tissues. So that's what supplies energy, helps manufacture, maintain, and repair cells. They're found in foods, and they're changed and used in the body through metabolism. So where are things metabolized are very important, and we'll get to that when we get to ostomies. It's very important to know which kind of ostomy you have because that's going to improve or decrease your B12 absorption. Carbohydrates are our primary energy source, and they come from sugars. So you do need carbohydrates, but is that the only thing you need? No, right? There's a max daily that you should be eating with carbs. Proteins build tissues, provide nitrogen balance, and also provide amino acids. So there are essential amino acids that you get from foods, and then there are some that you need to just take a vitamin for because they're non-essential amino acids. Protein is the building block of all tissues, I can't stress that enough. So if you have a wound or you're trying to recover from surgery, you probably want more protein in your diet. The other kind of factor is if they've had bariatric surgery, protein is more important than anything else on their plate because their stomachs are so small, they need to fill it up with what's most important. Lipids are fats, so these are a component of lipoproteins. They're backup energy source, and they provide organ insulation and protection. So you can't just go cold turkey on the lipids because you do need lipids with your proteins. So it's not enough to just have the skinless chicken all the time. There has to be some fats. Essential fatty acids, right? People will take an essential fatty acid or a krill oil tablet because we still need those essential fatty acids. Clicker check. A name brand ice cream containing the following information: 30 grams of carbs, 19 grams of fat, 5 grams of protein. The total number of calories in a serving would be. So, question, how many calories are in carbs, how many calories are in fat, and how many calories are in protein? That's something you just got to know. Okay? Let's go ahead to the answer so we can describe this a little better for you. So, fats are the most, they're 9 calories per gram. Carbs and protein are giving you 4 calories per gram. So fats are the most, so that's 19 times 9, 30 times 4, and 5 times 4. Okay. So you got 30 times 4 is your 120. 9 times 19 was 171. And 4 times your 5 grams of protein is 20. So that's how you get that answer. You gotta kind of remember this. That's just one of those things they're going to expect you to know, that fat has almost, a little over double of the calories per gram. That's why if you're on a diet, you do want fats, but where is it that I can cut calories? It's in my carbohydrates. The protein, I really don't want to cut my calories there because the building block of proteins, if somebody loses a lot of weight and they're not eating their proteins, they're going to gain it back because you got to keep your protein up. Micronutrients are things that we only need in small amounts. So vitamins and minerals, things like that, are considered micronutrients versus macronutrients. So again, water, the body is made up of a large percentage of water. It's the solvent for all chemical processes in the body. It transports substances. It forms tissues. And it has the ability to help you maintain your body temperature. So water is important. How much a day? Thought process. You need to remember how much water a day is recommended for a normal adult, right? So usually 6 to 8 8-ounce glasses a day, minimum. That's 64 ounces of water a day. Some people we are going to push water on, especially if they're dehydrated, they have mucus production, things like that. And then, of course, there are patients that we are going to reduce the amount of water they get because they're in renal failure. The energy balance concept is that we're kind of on a scale, and what goes in must come out. If we don't, then we gain weight or lose weight based on energy in, calories out, Calories out meaning exercise, calories in meaning stuff that you ate, right? So energy and nutrients are measured in calories. Calories in must equal calories burned. Too few calories, too few nutrients, you're undernourished. Too many calories, you end up obese. So how do I know what my energy level is? So there is a test that gets done in weight loss centers called the basal metabolism rate. And that's the amount of energy that are required at rest. So typically when they do this BMR, you're laying down, the machine is on, and you're literally just breathing in a tube for 60 minutes. That's going to let them know how many calories you need a day. So when you know that number, then you can decide replacing calories with BMR with your physical activity. How much physical activity do I need? How much reduction of calories do I need? So there are factors that affect our nutrition, including developmental stage. So what an infant needs and what an older adult needs is two different things, including what happens when you're lactating. You need 500 more calories a day when you're lactating, when you're making milk. Education level affects nutrition. Obviously, the more educated you are, the more you want to eat healthy. Education level also has to do with social economic level, right? So if you cannot afford it, you're going to choose more non-nutrient foods because that's all you can afford. The knowledge of nutrition comes with that educational level as well. Once you understand the concepts of access to healthcare, access to good nutrition, that also affects your nutrition status. So other things, developmental stage, lifestyle choices, vegetarianism, if you're eating health or if you're eating for weight loss, might look different. Ethnic, cultural, religious practices, disease processes and functional limitations, medications, and special diets. All of this can affect your nutrition. Another clicker check. Identify the patient with greatest risk of developing protein-calorie malnutrition. Okay, so let's talk about greatest risk. A client who has multiple sclerosis and is in a wheelchair. Protein-calorie malnutrition. A client weighing 300 pounds who has entered the hospital for cardiac bypass surgery. A client with a broken arm and femur from a trauma who is running a fever of 101.5. A client who is Native American heritage. Protein-calorie malnutrition. Greatest risk. A has multiple sclerosis and he's in a wheelchair. Does not mean that he can't eat. A client weighing 300 pounds who has entered the hospital for cardiac bypass surgery does not mean that he can't eat. Protein-calorie malnutrition. A broken arm and femur from trauma who is running a fever of 101.5. Is this person at risk for needing more protein to build back muscle and tissue, or a Native American heritage? So I get rid of D because I have no idea what that means to anything with protein-calorie malnutrition. The answer is going to be C because there's an increased demand for energy and nutrients. 1 is fever, 2 is broken bones. Okay. Screening for nutritional problems. The best way, I must be saying this for some reason, the best way to obtain a good history, to provide a good screening, is to talk to the patient about a 24-hour recall, a food diary, a food record, a food frequency questionnaire. Any one of these is perfect in case you were to see that somewhere in the near future. Any question about screening for nutritional problems is probably going to be the answer of a food diary, a 24-hour recall, a 2-day, a 3-day recall, right? But just think about yourself as a student. If I asked you right now to recall what you ate for the last 3 days, could you do it? Unless it's written down on my phone, I ain't gonna remember it. This is the problem with diets as well. If you want them to track, it better be on their phone in an app, because ain't nobody got time for tracking things all day long. Subjective global assessment. What does the patient say? A mini nutritional assessment. We can even do a screening of their nutrition. Body composition tests, lab results will also tell us nutritional problems. The best one will be a food diary. Nutritional imbalances, complete physical exam, a general survey, alterations in their vital signs, poor skin turgor, wound healing, concave abdomen, ascites, change in muscle mass. Okay, why do we have you do head-to-toe assessments? Because head-to-toe assessments are pretty important. Lab results. We're going to look for a blood glucose. That's going to tell us if there's diabetes. A serum albumin, creatinine, and hemoglobin. What does this tell us? Albumin is a protein in the blood. So that tells me my protein level. I'm more interested in a prealbumin. So there's albumin and prealbumin. I'm more worried about prealbumin because prealbumin tells me my storage. Over time, how is my storage going to be affected with wound care? Serum albumin, creatinine clearance. What does that sound like? Clearance of the kidneys. If protein's going in, it's got to be cleared by the kidneys. If I have kidney damage, I don't want to increase my protein. The protein's going to get backed up in my system and cause even more renal failure. So I need to know my creatinine level, and then I need to go get my hemoglobin done as well. Hemoglobin tells us what? Oxygen carrying capacity of the blood. So it tells me my status of the oxygen capacity of my blood. So it tells me if I'm anemic or not. If I'm anemic, I don't have enough iron. Iron binds with oxygen. I can't carry the oxygen to the cells. Hemoglobin tells me how anemic I am. So, y'all know BMI scale. When you are consuming nutrients in excess of metabolic demands, obesity can occur. So you need to know the classifications of obesity. So if you have a BMI of 25 to 29.9, you are considered overweight. After that, it goes up in class 1, 2, and 3. 3 is 40 or higher. If you have a BMI of 40 or higher, in most surgical programs, you do qualify for bariatric surgery. You may be in class 2 and qualify with a comorbidity. A comorbidity will get you bariatric surgery as well. My only caveat for that is you got to fix the mind, not just the stomach. Underweight means insufficient protein, fat, minerals, vitamins, consuming less calories than needed according to activity, gender, height, and weight. So when we talk about underweight, undernutrient, we kind of think two parts of this. Could be a child not getting the right nutrients. If it's the end of the month and the money has ran out and the formula can is almost empty, parents may be wanting to kind of make that can of formula work for the rest of the month for another couple days. They may overwater their formula, water it down to stretch it. That's actually a problem because you can get water intoxication. Undernutrients. Teenager with anorexia. They are activity heavy to burn whatever calories they have eaten. They are throwing up so that they don't have. They're restricting calories. Okay? You'll get more of that in mental health. All right, so you are caring for an adolescent who has a BMI of 36. What do you think could cause this patient's obesity? 5 contributing factors. 5 possible physical and emotional consequences for this adolescent with class 2 obesity. Just consider self-esteem, teenage, not going to have the best nutrient system of selecting right things to eat, right? Maybe a divorce. Maybe there's fighting at home. Family life comes into this. Maybe all our friends are doing it, right? Physical and emotional consequences, self-esteem, heart disease, renal disease, diabetes. Clicker check. The nurse knows the lab result that is the best indicator of client's nutritional status is the serum albumin. Client's nutritional status. True or false? What did I just say? What did I just say? Prealbumin has a shorter half-life and is a better indicator of the protein stores and acute changes in those stores. So prealbumin, when it happens on the NCLEX or it happens on a test, serum albumin is not the one we look at. It's prealbumin. All right, so when you get a nutritional imbalance, the planning you've got to consider is the etiology of the imbalance. What caused the imbalance? Is it too much, too little? What caused it? And that comes from asking the patient, like the 3-day recall, the 24-hour recall. Because once we see what they're physically eating, then we know how to correct that imbalance. If we don't and we just go, you should stop eating ice cream at night, that might not even be the issue. Okay? Etiologies for undernutrient. Undernutrient, difficulty swallowing, chewing, alcoholism, metabolic disorders. So we kind of talked about the alcoholism in lab when we were talking about the banana bag. The banana bag, if you are busy drinking, you're not going to have time to eat right. That's not going to be your priority. So a lot of those patients come in malnourished. They end up with the banana bag. The banana bag is B12. B12 is fixing the neurologic damage that they have done. Alcoholism blatantly affects the brain. So it's going to damage the brain and the brain tissues. So you're going to see neurologic issues with somebody who drinks a lot. Metabolic disorders. Which one? Hypothyroid, hyperthyroid. If you're hypothyroid, you understand that. You will get more about that next quarter when you start doing Med-Surg 1, because that's one of the things that you learn really early on, because that's one of the ones that you can fix easily. And then some of the etiologies for overweight and obesity. So metabolic disorder, undernutrition, hyperthyroid, overeating, lack of exercise, endocrine problems over here, hypothyroid. Hypo looks like a sloth. It slows everything in your body down, including metabolism. Hyperthyroid, hyper, like a cheetah, speeds it up. Okay? So thoughts to consider. Endocrine problems affect our nutritional balance. The outcomes are based on Healthy Person 2020, of course, now 2030. And it promotes health and reduction of chronic diseases associated with weight and diet. So more and more people are eating more and more because restaurants are serving more and more, and they're not taking the extra serving home for another meal. So there's a lot to do with the sugar industry and everything when you're thinking about it. Client teaching. Client teaching will surround vitamin, mineral supplements, nutritious food on a limited budget. What do we tell them? We tell them the most expensive food is probably along the outside aisles. That's also the healthiest. So how do I get nutritious foods on a limited budget? Potentially food stamps, food pantries. Sometimes you have to be very careful because food pantries typically have like peanut butter and stuff. Yes, they're high protein, but they can also be high in calories as well. All right. Make sure I got those. So nutritional needs, imbalances. What if they have trouble eating? Dentures don't fit. They might not eat, or they might only be eating liquids. Supporting special nutrient needs. What do we do when a patient's NPO? No more than 3 days? Still going to do oral care? Think about this, no more than 3 days, or else we really need to get a dietitian in. 3 days is a long time with no nutrients. You better be giving them an IV. Older adults, not being able to get up from their chair, arthritis, things like that, not being able to be mobile in their home. What do? Meals on wheels, microwave meals, something to make it easier on them. Nausea. We'll talk more in depth in the OB about that. But nausea, it's like not having really smelly foods in the room. Carbs first, right? The big thing for pregnant women is having a thing of crackers by their bedside. Crackers and a little protein would be even better, but crackers, something dry to settle their stomach before they eat. There's medications that we can give for nausea. Impaired swallowing. Impaired swallowing we did in the lab. Think about thicket. We might have to thicken up their food. We might have to go mechanical soft, pureed, or liquids. How else do we deal with impaired swallowing, thickening their foods and telling them chin to your chest when they swallow so that it goes down the right tube. Impaired digestive function. If we have an impaired digestive function, are there meds that we can give for that? That delay emptying time or make it longer, coat the stomach, right? So like carafate, sucrafate, it coats the stomach, making it less acid-rich environment. There's pH, right? Acid blockers. Okay. Assisting clients with meals. This is what we did in the lab. So in an inpatient facility, who can you delegate feeding to? Who can you not delegate feeding to? Why? What's the reasons we would or wouldn't? And then in home care, the answers to the question are going to be the questions are going to be referring to an agency to help obtain food. So think about where can we get food for these people? Meals on Wheels, senior center. There's things in the environment that we can use. Is there a homeless kitchen? Is there a meal delivery site? During the summer, during school being out, there's a lot of places that you can go and get a sack of food, one of them being All Children's Hospital. So all summer long, you see these posters for come to the cafeteria and get your free food for your child. The child comes in the front door and out the back, and nobody knows that there's a book bag of food for them, and they can come every single day. Okay? Inpatient is delegating feeding, and that again, you would not delegate if somebody's a fresh stroke without a swallow study because they're at risk for aspiration. Yeah. So if it's just setting up a tray, sure, the UAP can do that. The UAP can feed someone with 2 broken arms, right? Someone who's blind they can do. But think about, is there a safety issue if I send the CNA in to go feed a patient that has a fresh stroke? Managing nutritional imbalances. Assisting with calorie calculation, meal planning, exercise, lifestyle changes. Weigh weekly, suggest a food diary. These are interventions for obesity. When you think about the calculation of calories, that's again going to be your 9 calories for fat, your 4 calories for the carbs and the protein. A lot of people just don't understand how much they're eating a day. Under nutrition, seeking counseling from an eating disorder management center. Devise strategies to improve clients' appetite. We do this especially with cancer patients. At the end of life, does it really matter? Not really. So what we'll do at the end of life is hospice actually has a connection with Ben and Jerry's, especially in Vermont, where they are located. But hospice can get you Ben and Jerry's ice cream, full of fat, full of protein, right? If that's the only thing they're going to eat, let them eat it. How do you improve appetite? Pot. So if you look it up, there is a medication which is similar to pot that improves appetite. Think about it. When you do pot, you have the munchies. So we will give the patient these appetite stimulants to get them to eat. Enteral nutrition, if we need to, we'll go ahead and put in the G-tube, the PEG tube that we learned about upstairs. That's a reason why you would use the PEG tube. They're unable to eat themselves, they're swallowing issues, they're undernourished. It is amazing what a G-tube can do to someone. And they will come back. You think you've lost them, you think they're Alzheimer's, they're dementia, you feed them, they get renourished. It's amazing to see these people come back to life. Parental nutrition, that word that we talked about upstairs in the skills lab. Parental nutrition is TPN and lipids. That's when the bowel needs to rest, and we go ahead and put their nutrition through their IV line in a central line. So here's your Mickey. It's a G tube, gastrectomy, because gastrectomy tube means it's in the stomach, okay? J tube means that it's in the jejunum. The jejunum is a small or large intestine. You tell me, okay? So feeding tubes can go in the stomach or can actually go in the small bowel, okay? This is called a Mickey. In the old days, it used to have a more Mickey-like appearance, but this is called a Mickey or a button. This would be for a child, usually. So this site, you can see the balloon that's filled inside the stomach, keeping it in alignment. And then that little stopper gets plugged on top of it. It's less tubing than the one that we saw upstairs, but it's the same principle. It's a means to an end to get food into the stomach, bypassing the whole throat and everything. So this is a valuable option for somebody with throat cancer. They can't eat down their throat, so we might as well bypass it and go right into the stomach. So you're caring for a patient who is receiving chemo. He requires a PEG tube, which is percutaneously through the skin, endoscopic through a scope into the stomach, PEG tube, the one you saw upstairs, to improve nutritional status after experiencing intractable diarrhea and nausea, weight loss, and muscle wasting. So he's not able to eat. Everything he eats is coming right back out. What does the nurse know about the benefits of a PEG tube? What does the nurse do to manage the patient with a PEG tube? What did we say? 30 degrees elevation, aspiration, aspiration, aspiration. Right? What else do we do to manage that PEG feeding tube? We're going to either do continuous or bolus feedings. Need to replace water as well. Prevent diarrhea. Prevent aspiration. Prevent malnutrition. Don't water the formula down too much. Right? There's lots of things to consider. And then identify a potential ethical dilemma in the use of a PEG feeding tube. What would be the ethical dilemma? Feeding a patient that doesn't want to feed and wants to die? So are we keeping people alive for their monthly check? Tons of situations out there on the internet about a feeding tube. Parents want it removed. Ethically, we can't. What's the ethical dilemma of feeding someone? Okay. Fabulous.